Rhinos, Dr. F.J. Schofield, Rhino University, episode 3, going over the report of findings. So really important part of practice is the report of findings. It's huge. So first and second visit are gigantic. Obviously you have to get new patients in the door. First you got to attract them. Then you got to communicate so they understand what's going on. Most of the complaints I get from patients with other chiropractors is he or she didn't explain anything. I was just coming in, they'd adjust me, they'd say come back tomorrow or come back in 2 days, and I had no idea. So people want a plan, they want progression, they want engagement. It's really important you get to that. It's really important you help them understand what's going on in your mind. They want to know, they don't know. So you've got to take them through this process. And if you have a blueprint, now I know a lot of people are super scripted, like if you change one word, we're not like that at all. Okay, but we do have a blueprint. And it is nice to give people scripts to start with, because in the beginning you just have no idea. After you've had 5,000-10,000 reported findings and consultations, on new patients, and you've been adjusting hundreds of people a week, well then you have so much experience reading people and communicating, and it's very different. But in the beginning it's really nice to give people a place to start. But I do believe in a blueprint. A couple keys of the R.O.F. is, one huge mistake is people talk the entire time. They never ask questions. And they go way too long. It's a tendency always when you're speaking that if you don't have a structured plan, you're going to get wordy and you're going to talk too much, and then that waters down your message, waters down your impact, and you don't get the people that you could help. It's kind of like a bell curve. There's people over here that are going to commit no matter what you do. There's people over here that aren't going to commit no matter what you do. But there's a huge amount in the middle that if you communicate the right way will commit and follow through and get the results they need. If not, you're just praying that after 2 or 3 adjustments they're going to get well, and that's just not going to be the case for most people. It does happen occasionally, but most people, and the slow healers, you're just not going to help anyone because they're not going to stay long enough. So it's really important you get this report of findings, and you don't have to do what most people are teaching. You don't have to be super fear-based. You don't have to be really manipulative. You don't have to kick people out of your office. You don't have to do any of that. You can have fun, be principled, and run a really successful practice when you master the fundamentals. But most people are too lazy. They want the shortcut. Yeah, if you just say, oh, you have this thing, this subluxation, and it's worse than nuclear war, what's worse, a gun to your head or subluxation? Subluxation. But do you want to do that every day? That doesn't sound very fun for me. So you can if you want, up to you, but you don't have to do that. And when you create that much remorse, or that much fear, you're going to get a lot of buyer's remorse. And now with Google, I've seen a lot of those docs early on, they've taken down their Google's page, and you see a lot of those people, they always have problems with the boards and audits and this and that, because they're just not treating people the right way. So again, it's about helping that person, okay? That's the reason we're doing this, is to maximize our impact on as many people as we can, and you can do that in a fun, principled, ethical way, but you have to understand how to communicate, right? You have to understand the psychology of influence and persuasion to really maximize your impact on that patient. So one of the first keys is state the purpose. This is just like the first visit, right? You state the purpose. You let them know what's going to happen. A couple keys with this. So this is what we're going to do today. I'm going to go through your x-rays, go through the plan, and boom. A couple keys is, one, let them know it's okay to say no. That's the most important thing. All right, I'm going to go through your plan. Let me know if something doesn't work out for you. Okay? Let them know it's okay to say no. Or if you get, I want to think about it, then they're not comfortable with you. They're not, when you say it's okay to say no, then they can voice the objections. I don't want to come that much. That's too expensive. I don't know if I really need that much, or whatever. So, and them saying, I need to talk to my spouse about it, that's different. But state the purpose of the visit. Let them know what's going to be done, and let them know it's okay to say no. It's okay. All right? And, I'm going to go through this. If it doesn't work for you, please let me know. And you do it like that in a relaxed conversation. You're not yelling at this person. That's insane. You're just having a nice, relaxed conversation. Cool thing about, I literally have my patient, this graphic design, she edited and printed up my consultation in my R.O.F. How many people would let their patients see their consultation R.O.F? Guaranteed 99% of the groups out there would never do that. So So it's all ethical. She read it and she edited it and she goes, this is great. I wish every business knew this. They'd help way more people. Because it's about quality service, it's about communicating clearly, and it's about figuring out what that person really wants and showing them if they do this, that gives us the best chance to help them. Okay? So next you want to review review chief complaints and the quality of life limitation. So that's what I call it. Review chief complaints and the quality of life limitation. So what that is, the chief complaints are obviously whatever their pain and problems are. The quality of life limitation is whatever the pain is affecting, whatever the headaches is affecting. Now, every now and then you get someone that just moved to town and they love chiropractic and they believe in wellness and they come in and they're just like, I've been going once a month my whole life and I believe it. It's the best thing in the world. I don't get sick and it's great. And then you go, okay, come in once a month. Oh, that's perfect. You know, you've taken great care of your spine. But that's not the majority. We're not, chiropractic has not gotten to the point where it's standard care for most people. Not like dentistry and orthodontics where just about everyone who can, at least in the States, just about everyone who can takes their kid to a dentist within their first 2 years of life, puts braces on them by the time they're 12, 13. It'd be amazing if everyone took their kid, or 80% took their kid for the first year or two and then would come in for corrective care for the people who have had trauma, when they were, 10, 12, 13. That'd be unbelievable. But that's not the case. Most of the time it's chronic. It's probably been there since they were born. And it's been getting worse and worse and worse. And now it's gotten to a point where they're going to do something about it because it's affected something they care about. And you've got to find out what that is. And this is all great, relationship-based marketing, relationship-based selling is about that. Figuring out what's important to them. We're not transaction-based. That's when you just say anything to make a dollar. I'm not into that. You can go to another training if that's what you want. There's plenty out there that'll help you with that. That's not who we want to help. We want to help the people that really want to help that person, and they just need to learn the fundamentals to do it. And getting that quality of life limitation, figuring out what their quality of life goals are. Exercising again, working with wood again, playing with their grandkids, walking around the park. I've had moms drop their babies. Well, you don't ever want to do that again. Well, let's make that a reality. Bicycling again, golfing again, whatever it is, that's what you got to find out. And that's how you're going to motivate the person, right? If you know your why, if you have a why, you can endure almost any how. So that patient coming in every 2 to 3 times a week, that's how you're going to keep them focused. Great leaders, great coaches, they use that motivation that's intrinsic in the person they're trying to lead as the carrot. Okay, now you can use the fear if you want in the manipulation, but you don't need to. All right, better to just review that and you get them focused back on what's important for them. Get them off of time and money, because in the grand scheme of things, it's really not that big a commitment when you compare it to a back surgery and rehab after that. It's nothing. But, recency bias means you always think that this thing is, this is so much. No, but if you can look out a year, 3 years, 4 years, if we can make that a reality where you're exercising again, you're golfing again, you're playing with your grandkids again, you're working pain-free or whatever, you're going through your 5-mile walk, 3 times a week. If we can make that a reality, would you be willing to commit 2-3 times a week for 90 days? And yes, almost everyone's going to say yes to that when you know their reason. So really important to get that on the first visit and then to talk about it at the R.O.F. and start with it, that you refocus them right on that, because that's what matters to them. Okay, now you want to review a healthy spine. Review what a healthy spine looks like. Okay, they have no idea. So you just throw up a spine. You could throw up the sacrum, turn around, and the thing is the skull. It's like showing me my engine. My mechanic always pulls out. He brings my brake when we change them, and he shows me what a good brake looks like. He goes, that's what it should look like. That's what it looked like. We had to replace it. And I go, perfect. Here's whatever. $900, go do it. So, but I need that contrast. I need to know, what does good look like? Because I have no idea what a brake looks like. They need to know what a good spine looks like first and ask questions. It's very important you have questions in your R.O.F. You want most to be close-ended, yes or no. Can you see this? Can you see that? Yes, 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 yes. And then you want a few, okay, how does this compare to that? That's open-ended. Let them respond. Let them engage. Okay, can you see that, you know, this is here? Can you see that your head's off center? Yes. How does this compare there? Oh, this line's kicked up, correct. That means this is shifted off center. That's putting pressure here. Can you see that bone curving there? Yeah, that's degeneration. So you review a healthy spine, then you review their spine. So now they know what a good one looks like. Then you put it over there, and sometimes people are like, whoa! So you show them what it should be and what theirs is, okay? So and it's really important to go through that. Really, really important to go through that. And the lateral cervical is really nice to start with. And then I would recommend everyone teaches off the lateral. Everyone I've heard, 99% of chiropractors do it. Lateral of some kind, right? Some people use different line analysis, but it's always lateral. Sometimes it's flexion extension. Sometimes it's Gonstead. Sometimes it's clear. Sometimes it's this, but it's always lateral. So I'd recommend do the lateral. Lateral is great for showing degeneration, things like that, but then I would do an APOM or a NASIUM. I always do a NASIUM too. So I can show people something different so they can see I'm unique. Most chiropractors aren't really doing an x-ray analysis. It's a business tool. It's not a clinical tool. Make it a clinical tool in your office where you really analyze the x-rays. Okay? Most people are not adjusting the first visit, not because they need to analyze the x-rays, just because that's what a management group told them, and it builds up some value and urgency and makes it look like they're it's a whole smoke and mirrors. I'm encouraging you to actually be a great chiropractor, be clinically very, very good, and analyze the x-rays, and that way it's legit, number one, and number two, you're going to get much better results, get much better adjustments, you're going to get more people well, have more fun, more referrals, make more money, they're going to stay with you. So you're going to win big, big, long term. But most people are always thinking short term. Think long term, okay? So you review their spine, you go over whatever lines. I would draw a lot of lines in the beginning, and then up to you how you do after that. Then you want to review the phase of degeneration. The phase of degenerative dysplasia, the phase of decay. Get a poster to show them. Most people think, oh, my back hurts, but I can wait 5 years and it'll be the same. It's not going to be the same. Your back hurts because tissues are being damaged, and those muscles will pretty much always can go back to normal. There's a tremendous amount of blood supply, but those joints won't. And when you're getting that phase 3 degenerative disc disease, phase 4 degeneration, and that joint has been just destroyed, you're not going back. And a lot of times I'll see those people there, and they'll improve a little bit, but they will never be straight again because it's just too much tissue damage. And then you'll see with kids, it's amazing. Boom, a couple adjustments, they feel amazing, because their tissues are so much more resilient. So explaining that degeneration shows people, it creates the urgency and shows the scarcity. Listen, can you wait 3 or 4 months and it's not a big deal? Sure. Yeah. You don't have the time or money right now, 3 more. If you wait 10, 20 years, it's not going to be the same. It's going to be more degenerative. And then we're going to have a lot more work to do. It's going to take a lot more time. And then, of course, it costs more money, right? If I don't fix my roof and in 10 years I decide to do it and it's way worse, it costs me more money. That's just what it is. So showing them where they're at and then showing them the progression that it's going to get worse. And once they understand that, then most people are like, oh, I better do it now. Okay, and then also we'll get into marketing in some future videos on attracting the people you want that are ready to go. So then you like to get into tissue healing times. All right, why 90 days? Because it takes muscles about 12 to 16 weeks to heal. So that's why I focus on 90 days. It takes muscles about 12 to 16 weeks to heal. Once they heal, you're more stable. You don't have to come in as much. Your body will hold and heal with fewer visits. It takes nerves and soft tissues, roughly a year. Soft tissue, sometimes longer. Okay? And sometimes it's irreparable. There's just too much damage, so we're going to do the best we can to get you, improve your alignment and get you relief. So, but explaining that, you show them the reason. A lot of people, I think they do 12 weeks because I don't know why they do it. That's why I do it, because it takes muscles 12 to 16 weeks to heal. So I like to focus on the first 90 days. So I've gone through all those key points, right? I've explained, I've asked some questions, gotten some engagement. What do you think will happen if we don't do anything? It's going to get worse. Exactly. So we've gone through all of that, and then I go through the plan. And I get agreement. So, all right, I go through the plan. Also, analogies are really nice to take something unfamiliar and make it familiar. So what we do is a lot like braces for the spine. People know how that is, okay? They know that you put wires and moves the teeth alignment. We're going to use our hands, adjusting and x-rays to move your bones in alignment and make sure that we get it fixed. So an analogy like that is nice. It's the broken bone analogy, right? You get it in alignment, but the bone's not perfect. The first second it's in alignment, it has to heal. So it has to set, it has to stay in alignment for what? 6, 8, 12 weeks. Then it will heal. Same reason. You get your first adjustment, you're in better alignment. Well, the bone's not perfect. It's got to be casted. You can't cast your spine, so you got to keep coming in here so we can watch it very closely and make sure your alignment continues to improve and stays better. Or if it goes right back, if the bone goes right back out, it never heals. So these analogies of things they already understand help them make an unfamiliar topic familiar. Tires with the frame of tire, the frame of a car's car's alignment, the frame, and then the tires wearing out. People really get that when comparing it to soft tissues. And then, this disc compared to that disc, they're the same age. Why are they different? Alignment. There's more pressure on this disc. So showing all of that, and then get agreement. Can you get here 2 to 3 times, whatever, twice a week if you want to start twice. Can you get here twice a week for whatever, 8 weeks, 12 weeks, whatever you're doing. You don't have to do what I do. You can make your own. But get agreement on that, and then you're going to move to the finances, which you or your CAs, your office manager, can do. So practice this. You got to practice it a lot if you're going to, and then we'll get into the finances. There's a lot of, I do a lot more detail than just how long and how much. So we've covered the how long, we've explained where they're at, they understand that, you've got an agreement, and you've got them focused on what they want, the chief complaints, getting pain-free, the quality of life limitation, function, getting those wants. Those are the wants. The pain-free is the need. Those quality of life goals are the wants. So you've hit both, and you've gone through, and you've maximized your impact in my R.O.Fs. Lots of times are 5 to 7 minutes. Very, very quick. It doesn't take long to do all this once you nail it. Just 3 or 4 questions here. Can you see this? Can you see that? Yes, yes, yes. Okay, boom, how does this compare? Whoa, that's way, exactly. Can you see this? Can you see that? Can you see this wearing out? Yes. All right, if we don't do anything, what's going to happen? It's going to get worse. Exactly. Okay, you're here, phase 2. If we don't do anything in 10, 20, 30 years, you're going to be phase 4. All right, then tissue healing times, plan, adjustment, or agreement, and then you're done. So 5 minutes, that part's been covered. Now you can do the finances. That takes a few more minutes. And sometimes this is even quicker than that. It's not long. If you get 20 new patients a week, you can't be doing a 45-minute R.O.F. Even a 20, 30-minute R.O.F. You're going to be at the office all day long. So this lots of times, unless they're really analytical, sometimes it's even 3 to 5 minutes. Then you go into the financials, then you get them an adjustment. With the adjustment, you should not need more than 15 minutes unless your adjustments take quite a long time. You're doing some in-depth SOT or something, or some in-depth upper cervical work. But if your technique's pretty efficient, pretty fast, then full R.O.F. and adjustment, 15 minutes is all you need. Okay, so check this out, master it, commit it to memory. It will help you. We need more successful chiropractors, so please do this and get out there and help the people in your community and do it the right way. Dr. FJ, keep charging.